Hello, my name is Dr. Hayden McKay. I'm going to be presenting my research on achondroplasia, sleep apnea, and orthodontic interventions. This is a literature review with Dr. Joseph Chieffer as my PI. So as an introduction, achondroplasia is a genetic disease that causes a myriad of different problems, mainly short stature, some midface deficiencies, and one of those side effects are sleep apnea. And as the individual with achondroplasia often exhibit these structural abnormalities in their craniofacial and upper airway regions, predisposing them to sleep-related breathing disorders or sleep apnea. Orthodontic therapies can often help with these things, as we see in not just patients with achondroplasia, but the general population. So this review kind of investigates the relationship between both achondroplasia, sleep apnea, and the potential role of orthodontic treatments in improving the quality of life for these individuals and for others, but mainly focusing on those with achondroplasia. So a thorough review was done through PubMed, Medline, Google Scholar, all other accredited research information websites, and the results were compiled here, and I'll go over them. So sleep apnea, again, is characterized by repeated interruptions in breathing during sleep, leading to a wide range of adverse health outcomes. The relationship between achondroplasia and sleep apnea hasn't been studied in depth, really, until more recent times. Understanding this intricate relationship is crucial not only for enhancing the quality of life for individuals with achondroplasia, but also for advancing our understanding of the broader genetic and anatomic factors contributing to sleep apnea in the general population. So there is some crossover. It hopefully allows us to better treat these patients in the hospital and dental clinic setting, because oftentimes they're treated in both. Of particular note in recent studies is the potential for orthodontic interventions to improve sleep apnea in patients with achondroplasia, and these orthodontics offer various techniques and appliances that can address anatomical and structural issues associated with both achondroplasia and sleep apnea. Current studies have pointed to a hybrid approach of treatment with initial orthodontics and expansion combined with surgery to advance the midface. This provides the patient with the most aesthetic and functional outcome. Other treatments such as CPAP, continuous positive airway pressure, and adenotonsillectomy, taking out the tonsils and adenoids, can help, but are not permanent fixes for symptoms. So if these patients are dealing with sleep apnea, the traditional methods of wearing a CPAP at night or having your tonsils and adenoids removed can help for a little while, but they're not a permanent skeletal fix to the underlying issue. And you can see here in this before and after, a patient with achondroplasia was treated with braces and expander as well as jaw surgery, and achieved a great outcome. And also this patient in this study that we got it from, it did improve their sleep apnea symptoms and was able to breathe better. So there's a few modalities, mainly what I talked about before, the temporary fixes, as well as permanent skeletal fixes, which are mandibular advancement, maxillary advancement, palatal expansion, which we do often in orthodontics, and or routine orthodontic treatment, just getting those teeth in the right place, letting the jaws go to a more functional relationship, and creating space both for the nose and mouth in order to have more unobstructed breathing. So future directions for research would be a more in-depth look at the more common treatments in orthodontics and how they can help improve surgical and non-surgical outcomes for these patients. So it'd be nice to see a myriad of patients that have gone through orthodontic expanders and compare them before and after with their airways, and also to see how they compare to others in terms of those who haven't been treated with orthodontics. One of the problems with this, of course, is that achondroplasia is just not a very common disease, and so finding patients who have both been willing to participate in the study in the same geographic area is hard to find sometimes. So basically, in summary, the review that we've done shed a lot of great light on how orthodontics and oral surgery can both improve the life and quality of life of these patients. But I think a little bit more needs to be done in terms of studying how orthodontics, maybe just regular palatal expanders, braces, if that actually has, more of an outcome, more than just the psychosocial. So thank you for letting me present my research.